Win, sis. Welcome to my channel. This is the first episode and I'm really excited to bring you this channel. It's new for me. For those of you who used to follow me before, I was on Live on Purpose. You can still follow us there. Lots and lots of great information. But I wanted to dedicate this channel to helping those of us who are either going through cancer right now, you might have just been presented with a diagnosis, or possibly a friend of yours or a family member also has been presented with a diagnosis. I wanted to create a place for you to come and just have a conversation with me about your options, things to think about, and stuff like that. So this is going to be really relaxed. I'm not one of those YouTubers that is like super scripted or like on it. No, I just want to have a conversation with you guys to kind of let you all know that this is where you can come to get real information. Now, I do have a disclaimer. I am not a doctor, and so you can't take anything on this channel to be a diagnosis, a prognosis of treatment, a treatment plan, anything like that. Please seek medical professional help if you feel that you might be in danger or at risk of having any type of disease. This channel is specifically for me sharing my experiences so that you are more equipped, a little more educated, and possibly my experiences can help you out and help you through this tumultuous time. Because even though the diagnosis of the small C word, cancer, can be huge for yourself or for your family members, it still can be something that is manageable. It still can be something that does not completely take over your life, and you can survive. You can go through this and live life with a high quality of life. So I just wanted to create this channel so that you guys can come in, get this information, and really feel like that there is an end. Now, it is October. It's Pinktober, guys, and I am a breast cancer survivor along with a Hodgkin's disease, which is also cancer survivor as well. I'm a 3-time cancer survivor, and I am sipping on some hot chocolate with some maple, I think it's maple walnut something, whipped cream. So I know you guys are also enjoying some type of warm beverage as we go into the cold weather. Whenever you're watching this, this is Pinktober. You might be watching this next year in March, but just so you know, I taped this during October in 2020. 2020 is the year of craziness, but yet we are still surviving. We are still doing great things, and I'm super excited that you decided to join me today. So today I'm going to talk about 5 things that you should know relative to diagnostic testing. Maybe you're getting ready to go through a battery of tests and you're nervous. You're not sure what to think. You're not sure what to do. And so I just want to give you 5 quick pointers on things that you need to prepare you as you go into the next few testing appointments. You probably have had multiple tests scheduled for you. That could be including a biopsy. It could be including multiple scans. You might have anything from blood work to PET scans to CAT scans to MRIs. You might have a MUGA scan. So there's so many different scans that you might have. You also might have physical touch diagnostic testing as well. There's mammography, of course. There's all these different things, ultrasound, that can help the doctor diagnose and decide kind of what is going on inside of your body. Because of course they can't always see things from looking on the outside. So they need to be able to go and take some tissue or take some blood or take a look at some things and make a determination. And you really want to go through all of the tests that they prescribe for you, because you want to make sure that you are getting the best diagnosis, and you want the doctors to understand exactly what stage you're in, what level, all of that. You want to know as much as possible going in so that you can get the best treatment plan if your results are positive. Now, there's a very good chance that your results will be negative and everything will be, fine, but you do want to make sure that you continue to get the testing, because at some point there must have been some risk or some indication, and that's why you're here looking to find out more about diagnostic testing. So I'm going to talk to you about 5 things you should know. Sit back, relax, get your hot chocolate or whatever it is that you want to get, and I will be right back to talk to you about 5 things you need to know to be ready for your diagnostic testing. Thank you for being here. I'll be right back. Hey, it's your girl Purpose, and I'm back to give you those 5 things you need to know as you go on your diagnostic testing journey. Now, of course, this channel is all about helping those who might be dealing with a cancer diagnosis, whether you're a family member or an actual patient, or maybe you're a survivor and you just want to give some kudos and some feedback. Thank you guys for being here. Today, I'm talking about 5 things you need to know as you go on this journey. And of course, it all starts with diagnostic testing. So the first thing I want you guys to really, really think about and really take heed is to be prepared. That's number 1, be prepared. Now, I know it sounds like a Boy Scout thing where you're supposed to, everything that happens in your life, you're supposed to be prepared. Well, it's actually true. This can be a very anxious time, a very scary time. When there is a potential diagnosis of cancer on the table, there's so many different emotions and so many things that you go through and so many feelings that you're going to feel. Well, my thing is feel those things, but go ahead and prepare yourself for the journey. And diagnostic testing, whether it's 1 test or 7 tests, whether it's surgery, whether it's scans, no matter what it is, it does take a little bit of life out of you every time you have to go, whether it's getting blood drawn or whatever it looks like for you. So in order for you to be able to go through this process, I do encourage you to be prepared. Now, how? I would say the best way to be prepared is, number 1, ask questions. Some of these tests you haven't heard of before, or maybe you've heard of them and you've heard some horror stories about them. Regardless, I think it's important that you sit down and figure out what questions you have specifically about the testing that you're about to go through. Now, you can go ahead and reach out to your provider, maybe through MyChart if you have something like that, or you can send your doctor an email, or you could just reach directly out to them by giving them a phone call and letting them know, hey, can you give these questions to my doctor? I really think it's important that I need these answers prior to my test. They are more than happy to walk through what the testing is about. And hey, I get it. They might have already told you, but when you are in the doctor's office and they are like, hey, this is a potential thing and we need to do this and blah, blah, blah. Well, guess what? All of that stuff kind of just floats like a cloud right over your head and you forget, and that's okay. So go back, and it's okay to ask the same question multiple times. This is your life. And so you're trying to find out if you're about to be in the fight of your life. And so any questions should be answered joyfully. And don't worry, they will be there for you and answer those questions. Also, do some digging. Now, when I say do digging, I don't mean do the Google dig. A lot of us go and start Googling symptoms and diagnosis, and maybe I have this and maybe I have that. And I'll tell you, some of these websites have pure horror stories on them. Don't go digging diagnosis. Don't go digging symptoms. What I want you to do is dig the specific test name. It's easy for you to see exactly what is going to happen. They've got pictures of the test. Sometimes they have different slides of results that are possible. And so get some education around the actual test that you're going to be taking. It's going to also help when you have that conversation about your results with your provider to say, hey, well, I saw another test that I would be comfortable with doing just to be sure. But you want to have an educated conversation as much as possible with your provider so that you get the answers that you need to make you feel comfortable. That's what it's all about. It's all about you feeling comfortable. Now, Usually when you get these tests or when they make these appointments, they give you some paperwork. And a lot of times we take that paperwork and we put it in the car, or we throw it in our purse, or we hand it to someone else, and we don't really read through what that paperwork says. Listen, to be prepared, you need to read the paperwork. You need to know what's expected of you. You need to know, what type of requirements, what type of, food requirements before the night before, the day of. Like, you need to be well versed in what the expectations of you as a patient is, because you want to make sure these tests are as accurate as possible. And a lot of times, if you're not sure and you do something that might sway the test one way or the other, that will actually make you even more anxious, and you'll have to do the test all over again. And trust me, some of these tests you don't want to have to do all over again, believe me. Now, number 2 might also sound cliche, but a lot of us don't do it. You gotta be ready. Now, what does that mean? You might have multiple tests in one day. You need to get your rest. You need to eat. Knowing about the requirements for the night before and the day of, you need to eat properly. You need to rest. You need some time of meditation and quiet prayer, whatever it is that quiets your mind. Be ready means knowing, because you're prepared, knowing what the test is all about, knowing what the expectation of you will be on test day, and then being completely ready, having prepared your mind, having prepared, your knowledge of the test, and really having a good understanding of how you feel on the inside. You also want to bring support. Now, right now, if you're watching 10 years from now, right now is the big COVID year. And it's very possible that they won't let somebody in to kind of hang out with you. But you can ask them ahead of time. Let that be one of your questions as you prepare yourself. But have some support there, even if they're just in the parking lot. Even if they're just in the parking lot. Having them in the vicinity can make you feel better. And that is being ready. But most of all, when you're getting ready, get your mind ready. Start to quiet your mind. Start to go over, being prepared. Start to go over that educational material and know what to expect of the test, of the technicians, of yourself, so that you are completely ready for next steps. Now, this third one, number 3, is be patient. And it's funny that I'm saying that to you guys, because I have 0 patience. It's something that I'm working on. But a lot of these tests, you won't get the answer right away. You're going to walk away with not knowing. And that is going to feel like, oh my God, this is the worst. Some tests, especially, like I remember when I was diagnosed with breast cancer, I had the biopsy on like a Thursday. And so she didn't have the results to call me, I think, until Tuesday. Talk about a crazy, mental, the things that you do to yourself during that time waiting is nuts, right? And you try to put it in the back of your head, but you just got to be patient and understand that a lot of times these tests require a litany of other tests. Once they get a sample of something, or once they take some tissue or take some blood, then they have to take that and do multiple other tests just to be sure. So in the back of your mind, just keep thinking, well, this is for my good, because I want to make sure that they give me the best results possible and the most accurate results possible with what they were given. So you want to be patient. And I know it is difficult. It's not only difficult for you, it's heavily difficult for your family, because they want to know. They want to know. You told them you had to go get, a mammogram. You told them you had to go get a biopsy. And it's like, I want to know. Well, pathology takes time. Pathology takes time, because it definitely is all about the changing. So you might have a tissue right here ready to go to be tested. Well, then they have to treat it with something, because that agent has to, do what it does on that sample in order for it to give them the results that they need. So it's not because they're holding it back from you. It's because they really need to go through the pathology of whatever specimen they might have taken. So yes, you have to be patient. And so think of some fun things you can do. I think even that weekend that I was waiting, I think my daughter and I did some fun stuff that weekend. Just take your mind off of it and know that it's all for your good. It's all being done for the good of you. Now, I'm coming back with 4 and 5. Just stick and stay for a second. I'm coming back with 4 and 5 in just a second. All right, numbers 4 and 5 with the 5 things that you need to know when it comes to diagnostic testing. I'm just having a little hot chocolate. I hope you're enjoying something as well. So let's get it. Make sure that you subscribe to this channel. I'm going to be giving all types of great information. I'm going to be giving information for patients, for survivors, for family members. I am going to pull all of my experiences over the last, 15, 20 years and putting them all here because yes, I am a 3-time cancer survivor and I have seen kind of all there is to see, whether it's chemo, radiation, surgery. I've been there, done it. I've seen all the tests. I've been through all the tests. And so I'm speaking from experience. Again, I am not a doctor. I cannot diagnose you. I cannot give you a treatment plan, but what I can do is tell you what I know based on my experiences. All right, so number 4, be informed. Now, when I say be informed and I say read up on as much as you can, I don't mean, again, the potential diagnosis or the symptoms. I am saying that read up on your side effects. Again, take that paperwork out again. Read up on potential side effects from the test because yes, a lot of these tests do have side effects. There's one test in particular, 2 of them actually. One is called a PET scan where they actually shoot minerals up into your blood so that when they put you in the scan, specific cells, cancer cells or malignant cells will light up, right? So that mineral can cause different side effects. I know for me, I tasted the mineral, so you might have a metallic taste in your mouth. Also, your urine may be darker and it might smell metallic as well. So that's just one side effect. I don't want you to take a test and then be like, oh my God, what's wrong with my urine? Like, know ahead of time that there are some side effects relative to some tests that you're going to take, and don't freak out. It is absolutely normal. It's a normal side effect. Now, if it gets crazy, make sure you read up because if there are certain side effects that they ask you to contact the doctor, you want to be aware of those as well because if they present, you want to contact your doctor as soon as possible. So be informed. Especially if it's invasive. So if you've had to have a biopsy, maybe you had to have general anesthesia when you had that biopsy, maybe they removed a lump or something like that. Be very, very informed on what to expect afterwards. What's your healing time? What can you expect? What should you be looking for as warning signs that you need to go into the emergency room or you need to contact your doctor? Be informed and make sure that you're not the only one in your family or your household that's informed. Let somebody else know as well. So if you want to kind of start building your squad, and we're going to talk about that on this channel, but if you want to start building your squad and you want to have that person that just kind of reads over all your paperwork to make sure you're covered, make sure you identify them early, even if your results are negative. As you go through your life, you always want to have that one person that was like, well, I read this, that, and the other, and here's what you should expect. So definitely start identifying that person to help you out. But be informed, guys. You can't go wrong with being informed. So be prepared, be ready, be patient, right? Be informed. And the last one is be calm. The worst thing you can do is work yourself up into a frenzy. That is going to make your blood pressure higher. It is going to cause you to have anxiety, which will probably result in you being sick, maybe headaches, migraines, nausea, all things that you cannot and should not be dealing with as you go through these battery of tests. Trust me, you have to be sharp. You have to be focused, And you have to have your eyes on the prize, whatever that might look like for you. And for you to do that, you have to find a calm space. So do what makes you calm. Do what brings you peace. You know, if you're already dealing with stuff, drama, stuff in your family or whatever, it's time to stop it. It's time to deal with those demons and get rid of them. Trust me. If, in fact, you are dealing with a positive result to any of these tests, the road ahead is going to be crazy, guys. It's going to be crazy, but it can be manageable. It can be peaceful, but you have to start now. And that is anything that's going on in your life. You have to find the peace in it. You have to find the happy place in it. You have to just say, you know what, enough of this. It's meaningless. And you'll learn that in the face of something like cancer, it's meaningless. It means nothing compared to fighting for your life. So start to go through the drama, the muck, the crap, and start getting rid of it. You know, if you need to cut ties with something or someone, do that. If you need to mend fences with something or someone, do that. But do what makes you happy. Do what puts you at peace. And know that no matter what the result is, you can survive. You can have a high quality of life. And you may be saying, well, hey, Perp, listen, you know, everybody doesn't survive cancer. That's true. But the time that they have here, every moment that you have here, that we all have here, first of all, is not promised to us no matter whether we have cancer or not. But every moment that we have here is precious, and we have to live with a high quality of life every minute, every second, a high quality of life. So if you make the decision to be at peace, be calm, and just learn to deal with things as they come in the most positive way possible, then that is going to make the quality of your life and the quality of your time here in this physical body the most beautiful it can be. And at the end of the day, that's all we really want. We want quality of life. We want high quality of life. We want wonderful times with our families and friends. We want to be able to leave an impact on this life. And so dealing with craziness, dealing with drama just shortens our time here. And maybe not in hours and days, but it shortens our time here emotionally and physically. What you exert your time on will definitely reflect in your health. And now's not the time for drama and craziness. And you can tell them that purpose says so. So thank you so much for tuning in for the 5 things that you need to know for diagnostic testing. You can come here and learn some great things about the journey relative to cancer. Again, I'm a 3-time cancer survivor, and I just want to have a conversation with y'all to let you know that you can make it, you can get through it. And even though it's scary and it feels anxious, there is some things that I can share with you, my experiences that might help you just put yourself at ease a little bit and put your family at ease as well. I'm looking forward to sharing my experiences with you. If you know someone who has been diagnosed or who is going through it right now, and you might just want to give them a little word of encouragement, just send them on over to my channel. There's going to be a lot of love to give right here. I love each and every one of you guys. Thank you for tuning in. Make sure you subscribe and make sure you ring the bell in case I go live or when I upload a new video. Thank you guys for watching. This is the Unapologetic Survival Channel with your girl Purpose.